My responsibility and my work is with the Center of Excellence, which is a research facility funded by the VA and under the VISN 17 and here within the Central Texas Veterans Healthcare System. Our mandate is to investigate returning veterans with PTSD and other mental health issues. I'm a supervisor of bright young investigators who are looking into better treatments and ways of helping our returning veterans. We actually have many studies going on in a number of different areas. We have studies on treatment, improving treatment for our returning veterans with PTSD. We have other studies that are looking at suicide and how to help reduce suicide rates and those sorts of things. I was invited to go to this expert conference for the World Health Organization and the United Nations. About 15 experts from around the world were invited to discuss and to identify the importance of mental health in disaster relief around the world. My invitation was to be able to provide that information on evidence-based therapies for PTSD and how individuals dealing with disasters throughout the world could benefit from that. Historically, there has been sort of a disconnect between the mental health world and disaster relief. So there are people with, boots on the ground dealing with a disaster, and most of those issues are initially around food and shelter and safety and those kinds of things, and always secondary has been mental health. And so I think they were there has been this sort of disconnect, and so they were impressed with the kind of research and knowledge that we have about dealing with disasters from a mental health perspective and integrating that. The VA has been the leader in understanding post-traumatic stress disorder within the United States, but we're also being recognized worldwide as being able to offer information to the world on what kinds of treatments are effective and available and how these treatments can speak to disaster relief.